Welcome back, everyone. Last fall, Food Bank of Iowa joined Partnership for a Healthier America's Healthy Hunger Relief Initiative to work toward improving the health and well-being of those we serve. This includes implementing a new nutrition ranking system that will ensure Iowans in our 55 county service area have access to high quality, culturally relevant, and nutritious foods. I'm sorry about that. I'm having some technical difficulties here. Bear with me. Um, to learn more about our nutrition ranking system and the great benefit it will provide, please help me welcome Carmen Berry, Program Nutrition Manager for the Partnership for a Healthier America, as well as Food Bank of Iowa's Alyssa Bear and Ben Wary, who are leading the effort for us.
Hello, everybody. So I have some slides I'll be sharing with you guys today to kind of talk about our Healthy Hunger Relief Program here at Partnership for a Healthier America. So like Tammy said, I'm Carmen. I'm a registered dietitian, and I'm happy to be here today kind of talking through our program and partnership. So next slide, please. So here at Partnership for a Healthier America, we seek to transform the food landscape in pursuit of food equity. This is the idea that everyone, everywhere should have access to healthy and sustainable food. So to do this, we work at all levels of the food system with a variety of partners, companies, food banks, and many other organizations on a variety of very successful programs. Next slide. So founded in 2010, Partnership for a Healthier America, or you'll hear me call it PHA for short, was created to build on former First Lady Michelle Obama's Let's Move initiative. Our work started in the private sector, so we were leveraging the power of companies to transform the food landscape. But when COVID-19 made the impacts of an unequal food system on the health of under-resourced communities even more clear, our mission evolved to what it is today. So we currently partner with over 490 partners like companies and food banks and other organizations to improve aspects of the food system at every level. Next slide. So as you can see here, we take a multifaceted approach to the multi-level food system. So we aim to create lasting systemic changes that transform the food landscape in pursuit of health equity. We develop evidence-based approaches that are implemented in partnership with the private sector, like companies in the food industry, but also with the government and retail grocers and supermarkets, and also nonprofits like food banks and community organizations. So our unique variety of partners really enable us to accelerate that pace of transformation across the board and across the whole entire food system itself. Next slide. So we have the vision that all families in every zip code have affordable access to healthy, sustainable food. So that's food equity. We've made this commitment to provide 50 million servings of vegetables, fruits, and legumes to food insecure families by 2025. So we're working towards that goal through our many programs, which you can see on the screen here. So one of them is called Good Food for All. So this is a program that we provide families in need with 12 weeks of fresh produce to make vegetables and fruits a habit, while creating long-term changes to the food landscape. Our work in low-cost retail pilots came as a direct result of our Good Food for All program, where we kind of identified a unique opportunity to empower families with access to affordable grocery items and also meal kits. Our Veggies Early and Often program is one that we're aimed at working with the food industry that's making like baby food. So we're increasing these veggie forward options in the marketplace at all price points to build a generation of veggie lovers, because it really starts from the very beginning. Pass the love. So we worked on this program in partnership with former First Lady Michelle Obama. We provided meal kits to food insecure families in cities across the country while spreading the joy of cooking together at home. And this was in connection with a Netflix show called Waffles and Mochi that was hosted by Michelle Obama as well. Regional work in the Mississippi Delta. So we utilize national best practices as well as local knowledge and resources to uplift the health across the Mississippi Delta. And that's kind of how we're focusing on regional systems as well. And then mainly today, I'm here to talk about our Healthy Hunger Relief work. But if you're curious about any of our other programs, we have a lot of information on our website. But specifically for healthy hunger relief, we started this program in 2016, and it's really there to recognize and elevate and accelerate the work of food banks across the country that are already uplifting the health and well-being of their communities. Our Healthy Hunger Relief partners commit to implementing a comprehensive nutrition ranking system, which really enables them to truly understand the nutritional quality of their inventory and make those strategic decisions to improve the nutritional quality, thus enhancing food equity and then the health of the communities that they're serving. Next slide. So this is a snapshot of our partners. So we're coast to coast. We're here in Iowa. We're even up in Alaska. So we currently partner with 59 food banks across the country, reaching more than 14.7 million people across the country. Food Bank of Iowa joined on as a partner on October 1st of 2021, along with 31 other food banks at that time. So we were able to provide grant funding to all of our new Midwest partners to assist in capacity building to implement nutrition ranking, and also with produce purchasing to really infuse more of those nutritious foods into our Midwest communities. Next slide. So traditionally, many of the foods and beverages moving through the charitable food system are shelf-stable, highly processed foods that tend to be high in saturated fat, sodium, added sugars. According to a Maison report, and this was from 2018, 25% of food bank inventory is non-nutritious, like candy and soda. But in recent years, many of the organizations working in the charitable food system, like the Food Bank of Iowa, have really prioritized sourcing and supplying healthier foods, such as those as a lot of our partners across the Healthy Hunger Relief Program. So through the work of our 59 food bank partners, our partners have committed to rank more than 869 million pounds of food to really understand the nutritional quality of the food that's in the industry, but also adding more than 122 million pounds of healthy foods into the system and removing more than 19 million pounds of those low nutrition foods from the system, like candy or sheet cakes or cupcakes. Next slide. So in addition to the grant opportunities that I mentioned earlier, we also offer a wide variety of benefits to joining on as a partner. So I'm going to go through these very briefly. One of them is called WellScan. This is a digital tool to help food banks really simplify the process of nutrition ranking and easily identify, rank, and log the nutritional quality of inventory. We've recently launched our food equity tool. This is called our Healthy Hunger Relief Index. This just launched this past year. It's a yearly internal survey and a personalized progress report. That's to help food banks really identify where in their organization they can make small changes to really have those long-lasting, health-focused organizational changes. We have networking with food banks across the country, so all of our partners have the opportunity to connect together. Recognition at the national level, so since Partnership for a Healthier America is a national organization, being able to support and uplift our partners all across the country at the national level is really important. And then also tailored commitment support. So having a relationship partnership manager, myself, to really support our food banks on the journey towards implementing nutrition ranking. And then the quote here that you can see is from the Arkansas Food Bank. They're one of our Healthy Hunger Relief partners. And what's important to note is that they did have nutrition programming before becoming a partner, but really wanted to deepen their focus on nutrition across the organization. So Regina Taylor, their Chief Community Initiatives Officer, was quoted saying that in the course of 1 year, they went from viewing nutrition as a programmatic opportunity to really making it a priority in the way that they operate. So it's really what our Healthy Hunger Relief partners are about. It's accelerating the work that the food bank's already doing, but building that momentum across the entire organization, across the entire food system. So it's really embedding nutrition into everything that the organization does instead of having it as the standalone program. Next slide. So you may be wondering what exactly happens during partnership. So we do have 2 tracks. Food Bank of Iowa joined on this first track, the 2-year nutrition ranking track. And the goal here is simply to implement a comprehensive nutrition ranking system. So our partners are using the HER guidelines, which I'll dive into that in a little more detail shortly. But basically the goal of the guidelines or the recommendations is to improve the quality of foods in food banks and pantries, to increase that access to and promote healthier food choices for those facing food insecurity. So after 2 years of implementing a nutrition ranking program, our partners have all these processes and policies in place to utilize nutrition rankings. So it's really enabling them to understand the healthfulness of their inventory. But what do you do with that? What's next? I always say knowledge is power, and having the knowledge of your inventory really enables you in many ways to utilize that information, such as using it as a baseline to set goals or metrics for your purchases or donations, using the data to highlight the healthfulness of your inventory and your commitment to improving the health of your community, and just talking about how your organization is prioritizing that and having data to back up your statement. Showcasing the healthfulness, or maybe not the healthfulness, of donations from specific donors that really can spur that conversation towards more helpful donations. Sharing the nutrition ranking with community agencies like your food pantries to encourage selection of healthier items, and much more. So it's really very vast use of the data that you learn from implementing nutrition ranking. So for the support, the resources, the trainings, the toolkits to strategically use the knowledge gained, a lot of our partners transition from the nutrition ranking track to the inventory development track to really kind of accelerate their progress in making the inventories healthier. So in our inventory development track is where our food equity tool comes to light. This is our Healthy Hunger Relief Index. It's a tool that food banks can use to assess their organizational commitment to the healthfulness and improve their capabilities over time. So it's two parts. It's an internal survey that food banks take to assess and measure the depth of nutrition at the organization, and then a personalized progress report to identify action steps that really can build on your existing efforts and help the organization make progress faster, and really truly embedding nutrition in everything that the organization does. So the Healthy Hunger Relief food banks completed on an annual basis to kind of track progress over time, and that's the base of our inventory development track is our Healthy Hunger Relief Index. So Food Bank of Iowa has joined on for track 1, and I'm sure you're going to be hearing about the amazing progress that has already been made in the second half of this presentation. But before I get there, next slide, please. I'm going to be talking a little bit about the HER guidelines, giving a little background on the guidelines themselves. So the HER guidelines in 2019, Healthy Eating Research is a national program of the Robert Wood Johnson Foundation, convened a panel of experts. So you can see that on here on the screen. So these experts are in the charitable food system and nutrition and food policy fields. And the goal really was to create these clear, specific recommendations for evidence-based nutrition guidelines, specifically tailored to the unique needs and capacity of the charitable food system. So the goal of these recommendations is to improve the quality of foods in food banks and food pantries, to increase access to and promote healthier food choices for those facing food insecurity. So in addition to the expert panel, these guidelines were externally reviewed by food banks across the country. Oh, next slide, please. And you can see that here on the slide. So these food banks were developed or put together by a task force of Feeding America, and they really reviewed and provided a lot of feedback to the guidelines before they were finalized and released. So they were initially developed by these experts in nutrition and the charitable food industry, but then reviewed by the food banks themselves, the ones that are actually using and implementing the guidelines. So it has been reviewed by experts at many levels before being finalized and released. Next slide. The guidelines are intended to support systems change in the food bank and food pantry setting that ultimately will allow pantry clients to access healthier foods. So the panel considered the many dimensions of the charitable food system. Their key considerations are listed here on the screen, so I'm going to highlight like a few of them. So like respect and dignity. The guidelines really wanted to offer some flexibility to acknowledge and accommodate diversity with cultural food preferences and individual health needs. So it's really it was a big part of their consideration in developing the guidelines. Capacity and cost or reliance on volunteers. So they recognize that food banks and food pantries have varying capacity costs and oftentimes rely on volunteers who might have limited expertise in nutrition. So really keeping it simple and easy to understand and operationalize. Use of weight as a metric. This is kind of an interesting one that the guidelines really wanted to acknowledge that this might be a barrier. So food banks have historically measured their success by the number of pounds distributed, and that really focuses on food quantity rather than quality. which can be at odds when you have a goal to shift to a healthier inventory. So if you think of like lettuce or spinach, it's very light and fluffy, full of nutrients, but weighs practically nothing compared to a bottle of soda, which can be very heavy and has no nutrients or no nutritive value. And then the last one I wanted to mention was really the evolution of nutrition science and product formulation and consumer information. So the current guidelines are intended to be updated over time. It's not meant to be the final word because nutrition and the science behind nutrition is constantly changing. So these guidelines are meant to be able to be changed and updated as the science changes. Next slide. So it's teeny tiny on the screen, and I apologize for that. But in this comprehensive nutrition rankings system, food products are divided into 11 categories. So in those 11 categories, the foods are compared against each other. So like fruits and vegetables are compared against each other and not compared against cheese, which would have vastly different nutritional quality. So they're ranked into tiers. So the first tier is green or choose often. Yellow is choose sometimes, and then red is choose rarely. And the ranking is based on saturated fat, sodium, and added sugar, the nutrient thresholds for those three nutrients. And that all varies depending on the food category. Like I was mentioning, like an apple has no fats or sodium or added sugars compared to like a yogurt or a cheese product. So foods are compared against each other in their own food category. The expert panel chose to focus on these three nutrients to limit based on the evidence that links the increased consumption of to increased risk of diet-related chronic diseases like obesity, diabetes, hypertension, and cardiovascular disease. Those are all directly linked to saturated fat, sodium, and added sugar. This is also consistent with the dietary guidelines for Americans, which recommend limiting the consumption of those three items as part of a healthy dietary pattern. And then those nutrients are also easily located on the nutrition facts label, which can really simplify the implementation of the guidelines. Those nutrients are easy to find, and it's only 3 of them. You're not looking at everything on the label itself. And then some items can be automatically ranked, which is handy when you're looking at your inventory, like fresh fruits and vegetables, always green. Whole grain products like breads, pasta, tortillas, and if it's made with a whole grain, it's green. Brown rice is green. Yellow, 100% fruit juice is always yellow. Plain dried fruit like raisins is always yellow. Most peanut butter is yellow. And then red, automatically ranking all desserts, all candy, all soda, and most processed or packaged snack foods are also automatically ranked red. And then lastly, there are a few items that are purposefully not ranked. So like condiments and cooking staples are not ranked because they encourage home cooking and the consumption of other nutrient-dense foods. So you're not going to sit down and consume a whole bottle of oil or a bag of flour, but you might make a dinner for your family with it. So those items are purposefully not ranked. And then also baby food and nutrient supplements like Ensure or protein powders are also not ranked. So these guidelines are meant to be a simple way of identifying and providing that education about the healthfulness of your inventory, with that goal, again, to improve the nutritional quality of foods in food banks and food pantries, to increase access to and promote healthier food choices for those facing food insecurity. So thank you for listening to my half. I'm going to pass it on to Ben now.
Can you hear me okay? Awesome, awesome. Thanks so much, Carmen, for joining us today. Super happy to have you here and to be partnered with PHA. You've been super helpful. And a big thank you to everyone for being here today. I know most of you are partner agencies of ours, and to all of you, I'm grateful to work alongside you. Your passion and commitment is inspirational, and it just adds to the fuel to end hunger. I'm excited to share with everyone our new focus on nutrition and nutrition ranking. Before I get into the ranking, I did want to take a chance to acknowledge that there may be some of you wondering why a food bank or food pantry would choose to focus on nutrition in the first place. And in order to help everyone understand why we have put a focus on nutrition, I'll take a chance to show you some statistics. The first piece is from Dr. Craig Gunderson, which he's done a lot of work for, food banking, but just food insecurity as a whole. His research has found that total healthcare costs and average costs for inpatient hospital care, emergency department visits, physician services, same-day surgeries, home care services, they all rose systematically with increasing severity of household food insecurity, which is recognized in three different levels, at least in his research, which was marginal, moderate, or severe food insecurity. So if you go to the next slide, thank you. When compared with the total annual healthcare costs in food secure households, which you can see there on the far left, the adjusted annual costs were 16% higher in households with marginal food insecurity, 32% higher in households with moderate food insecurity, and 76% higher in households with severe food insecurity. And to add a monetary value to those percentages, it's $235 higher for marginal food insecure households, $455 higher in households with moderate food insecurity, and over $1,000 higher in households with severe food insecurity. And you can go to the next slide. And what was even more interesting in Craig's studies, it was determined that individuals from food insecure households had increased odds of using healthcare services compared to individuals from food insecure households. So you can see in this graph, an individual who comes from a marginally food insecure household has a slightly higher likelihood to incur healthcare costs, whereas a moderately food insecure household, someone from that household might be 1.3 times more likely to take on healthcare costs. And then for the most severe, for households experiencing the worst, most severe type of food insecurity, they're almost twice as likely to use healthcare services and incur subsequent costs. And in the worst cases, there are households who are more than twice as likely to take on these costs. Credit to Craig and his colleagues for collecting that profound data. Next slide. What I'll share second, I pulled from Feeding America. Of all the households served by the Feeding America network, so that's the Food Bank of Iowa, that's all of you who were partnered with us, that's all of the food banks and food pantries, a part of the Feeding America network in the United States. Nearly 2/3 of those households choose between paying for food or paying for medical care. And to cope, 79% of those households purchase inexpensive or unhealthy food to kind of curb the burden. And on the next slide, I'll share the last piece of information. This is from the National Institutes of Health, and it's just reiterating that that low-cost diets are associated with higher calorie intake at the expense of fewer nutrients. So where on the other hand, healthy diet is inversely associated with obesity, diabetes, cardiovascular disease, stroke, and cancer. An unhealthy diet, one that's higher calorie, lower nutrient, is worse off for health outcomes. And this is very similar to what the experts on the health eating research guideline panel acknowledged, as Carmen mentioned. So if you want to go to the next slide. So what we can conclude from all of this is that food insecure households frequently choose between paying for food or paying for medical care. and ease that pressure by utilizing lower cost, higher calorie foods. Households that consume those higher calorie and low nutrient dense foods are at higher risk for obesity, diabetes, heart disease, stroke, which culminates to increased needs for medical care and the resulting costs. These are the same households that are more likely to need healthcare services, the same households that incur medical costs at a higher disproportionate rate compared to food secure homes. So you can see how this kind of becomes a cycle. In an effort to break that cycle, more food banks have adopted a focus on nutrition, and a lot of food pantries have actually adopted a focus on nutrition before some of the food bank who they're partnered with has. And so it's at all levels of the charitable food system. And one of the first steps towards adopting a good focus on nutrition is to monitor food bank inventory and classifying food bank inventory or food inventory for food banks and food pantries according to nutritional value. So there are several different methods that rank food. Up until recently, the Food Bank of Iowa has ranked inventory using the Foods to Encourage method, otherwise referenced as F2E. It's been around for a super long time. Feeding America, they kind of came up with it a long time ago as kind of just a first go at trying to keep track of nutrition in food banking. It was not a perfect system. They just wanted something in place as a starting point. And so because the Foods to Encourage model is recognized by Feeding America, that model is the inventory tracking system of choice for the majority of network food banks. Something in the range of 60% use the F2E model. And in the next slide here, I'll share some F2E data with you. So when it comes to Foods to Encourage, our food bank is right around the national average of other food banks who use the F2E model, which is about 71%. And this is just the past 4 fiscal years. While it's a better model than nothing, one major downfall is that it overgeneralizes food groups and their respective nutritional value. As Carmen already introduced, the Healthy Eating Research Guidelines, known as, I reference them as HER or HER guidelines, are a very accurate way to rank food. And as a result, it's a much more accurate method than Foods to Encourage. And I can kind of explain in better detail. In the next slide, you'll see, so of all the pounds of food distributed in the dairy category for the month of February 2022, that's just a couple months ago, which was about 130,000 pounds, only 30% of that category, the dairy category, is considered foods to encourage under the F2E model. And that's just a standard of what Feeding America at the time that they developed this determined was fitting. So on the right, you can see if we rank according to the Healthy Eating Research Guidelines, we know for certain that 63% of the pounds of dairy distributed in February fall into the green or choose often category under the HER guidelines, which equates to a little over 81,000 pounds. That's more than twice as many good or green pounds of dairy than the F2E model reports. So it's important that we accurately capture those pounds. And it's good to know that data. And I'll share one more piece of information on the next slide. You'll see if we consider our March 2022 distribution pounds, the Food Bank of Iowa distributed over 23,000 pounds of food in the meals, soups, entree category. Under the F2E model, 0% of that category qualifies as foods to encourage, but we found that at least 12,300 pounds from this category ranked as choose often under the HER guidelines, which is over 6 tons of food going unaccounted for by using the F2E model, foods to encourage model. So next slide, please. This is an issue just for, it's not just an issue for the good pounds, but also for bad pounds. For example, 100% of the meat, fish, poultry category is considered good under the F2E model, the foods to encourage model, which is misleading because we know that 100% of meat that we distribute is not ranked as choose often under the healthy eating research guidelines. So by operating solely on foods to encourage, we're not accurately capturing data, and we're missing out on very important data actually. And this is where our new bond with Partnership for Healthier America comes in through the Healthy Hunger Relief Program. As Carmen already said, the Healthy Hunger Relief Program incorporates the HER guidelines, and that's exciting for us at the Food Bank of Iowa because it's a big upgrade from foods to encourage. Right away, we saw just the potential in this new partnership. We wanted to utilize the new relationship to the fullest, but we didn't want to just fulfill the partnership agreements. We didn't want to do just the bare minimum. We wanted to make this our own and use it as a starting point for a really good initiative. And next slide, please. Our new focus on nutrition will take into account this partnership with Partnership for Healthier America, the Healthy Eating Research Guidelines, and the Food Bank of Iowa mission. The objective is clear, and that's to increase the sourcing and distribution of nutritious foods and fresh produce. Next slide. The first component of our nutrition efforts begins with Partnership for Healthier America. Since 2016, they and their Healthy Hunger Relief Program has provided food banks with a starting point for improving the nutritional content of food inventory. And one major benefit that we recognized pretty quickly, which Carmen already introduced, was WellScan. Our food bank has already incorporated this tool into operations because it's so easy and simple to use. It can be used by any one of our team members, and it just makes the process of receiving food and ranking it right then and there so easy. And this all takes care of the inventory. So the other focus of this partnership is committing to the increased sourcing and distribution of fresh produce. And then next slide. There's the second component of our nutrition focus, and that's the HER guidelines. As Carmen shared, they were developed by a panel of experts who come from a range of differing backgrounds. And you can click over one more slide, please. You can see the clear and specific thresholds. I'm sure it's super small, like it was in Carmen's presentation, but you can see that there's specific thresholds for each of the 11 food categories, defined as choose often, choose sometimes, choose rarely, or unranked. And it's based on sodium, saturated fat, and added sugar content. The HER guidelines are they're a centerpiece for any food bank with a formal nutrition focus. While the guidelines are part of the Healthy Hunger Relief Program in our PHA partnership, we wanted to acknowledge that the HER guidelines are still standalone and they should be recognized independently. This way, the thresholds that are outlined by the Healthy Eating Research Guidelines are being followed strictly and understood fluently by everyone here. Next slide. And the final component is the Food Bank of Iowa mission. We provide food to Iowa children, families, and seniors to lead full and active lives, strengthening the communities where they live. Like all other aspects of food banking, we need to be considerate of who we serve and how we do that. Nutrition is significant, but food itself is significant. And right now, especially, we're in such a precarious position with the Emergency Food Assistance Program, or TFAP, commodities being scaled back by USDA at the same time that SNAP funding is decreasing for our state. Even though those changes are so recent, we're already seeing increases in the frequency of partner ordering or the size of orders. It's important that we remain unbiased towards foods and continue sourcing what food we can, but still track the nutrient quality and make concerted efforts to provide the best food possible to an already at-risk group of our neighbors. And we call this nutrition equity. Those three components, this Healthy Hunger Relief Program partnership, the HER guidelines, and the food bank mission all come together to form nutrition equity. And now we can consider where we started and where we are, where we're going in the next slide. Since our partnership began with PHA, Partnership for Healthier America, in September of 2021, just last year, we have become fully literate in the healthy eating research guidelines and have understood the significance of the guidelines. And to test our literacy, we went through our food inventory and did a preliminary nutrition ranking. And since then, 100% of our, and I should specify that was in the Des Moines distribution center location. Since then, 100% of our Des Moines distribution center inventory has been classified, meaning that every single item that we have falls into either the choose often, choose sometimes, choose rarely, or unranked category. The results of that, currently 2/3 of our Des Moines food inventory ranks as choose often or choose sometimes, while less than 10% of our food inventory at the Des Moines DC ranks as items to choose rarely. So it's pretty reassuring for us to see. We already had a good idea that we were doing pretty well, but it's confirming, it's reassuring to see that in the ranking itself. The Ottumwa Distribution Center will have its food inventory ranking complete sometime this summer. In addition to the ranking of our inventory, we have stepped up our sourcing of fresh produce, which we can all thank Emily, our food sourcing guru, for. We get a full truckload of fresh potatoes every other week. In addition to the potatoes, we get a truckload of assorted produce once a month, and that Assorted produce consists of a variety of apples, oranges, onions, pineapples, peppers, and more. I know I'm talking to a group of individuals who sees our inventory frequently, and I know you've already seen these, but that's where those items are coming from. As we look ahead, we aim to continue our produce purchasing and making those items consistently available to all of you, our partners. As Carmen mentioned, the Healthy Hunger Relief Program that we're a part of has a second track, and that will push us to do more, including that we get 70% of our food inventory to classify as foods to choose often or choose sometimes, following the HER guidelines. And we're already super close, sitting at about 67%, falling into those two categories. We look forward to offering partner support and guidance for nutrition implementation within their own operations as we become more developed in our nutrition equity. Until then, just keep a lookout for the nutrition. There'll be you'll see it on your ordering screen. There will be a column for nutrition that'll become available at some point this summer. You can go to the next slide, please. We'll wrap it up. Hopefully I've done a decent job of sharing what we've done so far and more importantly, why we've decided to do so. I know there were a lot of facts and figures thrown out there, so please don't hesitate to ask any questions if you have them. We're still very much in our infancy when it comes to nutrition and nutrition ranking, but I'm certain all of our efforts will create lasting change for the better. I didn't see if there were any questions.
Let's see here. Please, anybody, if you have any questions, just go ahead and type them in the chat as you've done earlier. We're happy to answer any questions you may have regarding our new nutritional guidelines focus. You'll just go in and order like you normally would on Primarius. It'll just be an additional column, so it really isn't any retraining on how you place your orders. It's just more of a recognition of the nutritional value of the food that we have on our inventory. Super helpful if you know that you're serving people who have high blood pressure, diabetes, heart disease, some of your seniors that have a special diet and need to focus on certain nutritional qualities, that you can really help them guide their choices in your pantry and become a little more educated yourselves as you're making those placing those orders, as you recognize what are in those green categories, and being able to share that great information with the neighbors that you serve. Let's see if there's any questions here still. Let's see here. Well, I definitely want to give a big thank you to Carmen, Ben, and Alyssa for your great information. Definitely want to note and highlight it doesn't change how you place your orders. And it's just a great opportunity to just be more educated and more informed, and to then pass that information on to the neighbors in need. Ben and Alyssa, Carmen, do you have any added wisdom that you want to put in there, or anything else you want to add?
Yeah, I would add something else. I don't know if Carmen or Alyssa had anything, but if we still had time, which it looks like we do, I did want to share. There are a couple stories. It's just kind of a final note for me. The first was a story from a fellow Feeding America Network pantry. you'll have to forgive me. I don't remember the name of the pantry. I know they were outside of our service area. It was a story that was shared by one of the network food banks from a different state during one of our conferences. And the story that they shared went something along the lines of this. Someone was making a visit to their neighborhood pantry and noticed that this pantry had a cake. When asked if the cake was for someone, the volunteer of the pantry replied, no, it was a retail donation that we received earlier. The person who was visiting the pantry said that they would like to take the cake to the grandmother's birthday party. When the pantry volunteer said, well, of course, have it, the pantry visitor was pretty happy. The person that was visiting his pantry didn't have anything to celebrate their grandmother's birthday, but they planned to get together anyway. But after getting that cake, that family was able to celebrate birthday in proper fashion, I guess, and that's with a cake. And the second story is one that happened here at our food bank about a year and a half ago. There was a donation that we were set to receive from a local retailer. It was like 2 truckloads of frozen pizzas, and in fact, many of you might remember having those pizzas available on our inventory here. While the donation can be considered an amazing donation, which it was, I found myself personally wishing that the food were of greater nutritional value, because who doesn't want to give the best thing possible to the people that we're serving? One of my coworkers shared a very valuable thought with me that day, and that thought is, there is a good chance that many of the people we're serving are already getting frozen pizzas, but with their own money. So if they can source that pizza from us, they can put that money that they would have spent on pizza and put it towards other groceries that they might not have been able to have gotten otherwise. So and beyond that, they could have put that money towards paying for car insurance or paying for rent. There's so much that they could do. The point of these 2 stories is one and the same. While pizza and cake are foods that rank as choose rarely under the healthy eating research guidelines, these are foods that still serve a valuable purpose. And many times food is more than just the nutritional value. As we go forward with our nutrition efforts, we will continue to be mindful of our purpose and our role within the many communities that we serve across the state. That's all I wanted to share.
Thanks, Ben. That's great. I love to hear those stories come through. We hear so many great things through our partners, that we love to pass on. So definitely all food has value. There's just some different ways of looking at it, and a nutritional focus is definitely really valuable, and will serve us well in our days to come. There are a couple of questions in the chat, so I'll toss these out to whomever wants to answer those. Will there be a way to evaluate nutrition on food from the Food Rescue Program? Who wants to take that one? Oh, Alyssa. Alyssa said she'll take that one.
Yeah. We will have, it's kind of under development right now. We have some pieces of it, but we don't have all of the pieces in place just yet. But if you are interested in implementing this at your pantry or your program, we will be able to provide you some tools to help with that. So obviously, most of you are getting either food rescue or donations from your local community, or you're purchasing items, and we can't rank those for you, but we can give you kind of the details that you saw in both Ben and Carmen's presentations. It was hard to see in the presentation, but when you see it in person, it's very, very easy to follow. And you will just look at that sodium, added sugar, and saturated fat, and you'll be able to place those items in their respective categories. So yeah, they would be a tool for you to do that.
That's great. So really anything with a nutrition label can be ranked. So that's something, that our partners absolutely can use within their own agencies. So it's something that, not only benefits us here at the food bank, but will benefit you at your agency as you're looking at the food that you bring in through your own donations. Another question, what is the fridge life of the fruits and vegetables offered through the food bank? That is a concern when ordering.
I can chime in on that. So all of that's a great question, by the way. All of the produce purchasing that we've been doing, it's fresh produce, so it's a great question because I mean one might think, well, we're a food bank, we get a lot of donations, so maybe the produce that we're getting is secondhand or third hand. We're coming from somewhere being handed down the line, but this is all purchased produce. So we are sourcing these directly from vendors. They're coming straight to us from as fresh as they could be. So the fridge life should be as good as, I mean, not just the fridge life, the life in general of the produce is just as good as what you or I would get from a grocery store.
Alyssa, do you have anything you'd like to add to that?
Yeah, I would just say, produce is hard to put a finite time frame on. You can't really say this potato is going to last 27 days. So just use your best judgment, smell, appearance, if you would be comfortable eating it or distributing it to your neighbors. Just use your best judgment with those types of things that don't have kind of that finite timeline like maybe some other items do. And then also just keep in mind, safe storage will really extend the life of that produce. So just making sure it's stored correctly. If you have different areas of your refrigerator that are specifically for vegetables, consider keeping them in there. If you're lucky enough to have a very large refrigerator that maybe or you have two and you can keep one a little bit warmer and one a little bit cooler. Some of the produce will do better in varying temperatures, but just use your best judgment for those types of things.
Yeah, and we're heading into the season two, where there will be fresh harvests available to us through donations. And so there will be a wide variety of different items. And of course, they all come to us at different times too. And luckily, at the Food Bank of Iowa, we have our produce on inventory with no shared maintenance fee. So we will never distribute anything to a partner that we wouldn't eat ourselves, at least not willingly. So, there might be something hidden in there or, one bag with a bad potato in it or something here and there, but it's really rare. But I just wouldn't hesitate to order produce from us because it's fantastic that we deliver it to your door for free, but it also is perishable, and our perishable items have no shared maintenance fee. So the risk is very little to you, and we definitely will not ever knowingly send you anything that is not edible. So I hope that's not, I hope that helps some. And certainly if there's further questions, we're happy to answer those too. It looks like that might be all of the questions we have for this session. Again, thank you, Carmen, for joining us, and Ben and Alyssa again for jumping on through the day here today. It's been such a great day, and I thank you all and thank everybody in attendance for joining us. It's been a pleasure to share this day with you and discuss our best practices and how we can all together work to better serve Iowans who need our support and our help. Now, for the moment you've been waiting for, I'd like to turn the program over to Michelle to recognize our partners celebrating milestone anniversaries. Along with the Food Bank of Iowa in our 40th year, we're going to recognize our partners who are also celebrating some anniversary years as well. We have an exciting prize drawing for those of you who've stayed with us until the end. So we will do 5 drawings, one for each region for a $100 credit to your food bank account. So with that, I'm going to go ahead and turn it over again to Michelle. Thank you.
Good afternoon. We're in the home stretch. It's been a great day. I hope if you have one key takeaway from the conference today, I hope you know that the Food Bank of Iowa exists solely as a resource for you and your agency. Our role is to help remove barriers so you can be successful. As we move into another challenging year of need, please stay in touch with your regional partnership coordinator. Your RPC is the conduit for letting us know how we may best collaborate to be in service with you and your community. Before we wrap up and go to the drawing, we have one last but very special video to share. Let's take a look now. I congratulate all of you as we celebrate these significant partnership milestones, and as we also recognize the Food Bank of Iowa's 40th anniversary. You are the foundation of this unstoppable Food Bank of Iowa network. It's now time to draw for prizes. When I call your name, please type your name into the chat box to let us know that you're present. Without a response, I will continue to draw names until we have a winner who is present. I'm going to go into my chat box so I can see what's going on. All right. This is Region 1. See who we have here. Whoa. Angela Kofoot with Dickinson County Hunger Coalition. Let's move on. Janet Lansing with Iowa Central Community College in Webster County. We'll try again. Di Daniels, Friends with Food in Buena Vista County. One more. Peggy Milton, Lorenz Food Bank in Pocahontas. I hope I'm seeing my chat messages appropriately or accurately. Di Daniels is on. All right, Region 1, the $100 credit goes to Di Daniels and her agency. Congratulations, Di. Region 2. I can't see it. Why don't you tell me? I'm going to stand right here. Okay. All right, Region 2. We're going to work out the technical difficulty here. Marilyn Hoffman in Lake Mills Food Shelf in Winnebago County. Just give me a thumbs up or down. All right, we're going to move on. Bill Credo, Britt Area Food Bank in Hancock County. All right, we'll move on. Bonnie Nahas, Neighborhood Food Bank, Winnebago County. Bonnie is on, and we award this $100 credit to the Neighborhood Food Bank. We're going on to Region 3. Crystal Ellis, Norwalk Area Ministerial Association in Warren County. And Crystal's here. Congratulations, Crystal. Moving on to Region 4. Amanda West at IHYC in Polk County. Is Amanda on? Congratulations, Amanda. We'll be crediting your account for $100 this week. And Region 5. Kay Alleman, the Salvation Army in Des Moines. All right, that concludes our drawing. Congratulations to the winners of today's drawing. We'll place the $100 credit on your account this week. Well, this has been a very informative day, and I'm sure you have lots to process. I know my brain is full. I hope you gained insightful knowledge into what our future holds together. I want to thank Tammy Nielsen and Lexi Prigge for programming today's event, and Alessa, Ben, Emily, and Sonia, who shared valuable knowledge. Most especially, thank you for joining us, for giving us your time, your attention, and your curiosity. I'm grateful for you.